Welcome to On the Other Hand, our podcast. My name is Dr. Brett Kinsler, and I do love the controversial topics concerning chiropractic, alternative medicine, and healthcare. And let me tell you, it doesn't get a whole lot more controversial than chiropractic and stroke. And that's what today's episode is about. Specifically, do chiropractors cause strokes with cervical manipulation? Is there more risk than there is benefit? And should chiropractors be required to disclose risks to their patients? Let me tell you where a lot of this began. In the spring of 2005, a billboard sprung up in the parking lot of an Italian restaurant in New Haven, Connecticut. The sign warned, "Chiropractic adjustments can kill or permanently disable you." Very quickly, Connecticut became the eye of the chiropractic stroke debate storm. Speaking on this today is my guest, Dr. Stephen Pearl. He holds a tenured appointment as a professor of clinical sciences at the University of Bridgeport College of Chiropractic in Connecticut. He's the ethics columnist for Dynamic Chiropractic and the American Chiropractic Association's ACA News. He's also an associate editor of the peer-reviewed journal Chiropractic and Osteopathy. Dr. Stephen Pearl, welcome to On the Other Hand.
Thank you.
Now, can you give us a little capsule summary of what brought Connecticut into the focus of this stroke controversy?
It appears that what happened was a couple of people who had seen chiropractors and then proceeded to have some stroke some period after that are the ones who started this. They seem to have financial resources, and they appear to be, quite angry despite whatever may have gone on in court, and they've decided that the problem is pervasive of the profession and that they have to tell the world how truly dangerous they believe the chiropractic profession is.
They were telling the world using newspaper ads and public bus ads. There was even a television commercial in Connecticut, I think.
I'm not sure about the television commercial, but they even took out an advertisement in the yellow pages under chiropractors as a chiropractic referral service, which wasn't quite accurate. And they've been pretty relentless in lobbying our legislature, and it's apparent that their intent is to go after chiropractic. They're not. It's one of those funny things that they try and say this is all in a public interest kind of thing. But if it was a public interest issue, then clearly they should be going after, if they believe cervical manipulation is so dangerous, they should be going after cervical manipulation, not chiropractic. And their goal has been specifically an attack on chiropractic. Their billboards don't say that cervical manipulation is dangerous. They don't say anything like that. They don't talk as if anyone else on the planet does manipulation when naturopaths do in this state, and definitely physical therapists do. In fact, the law was changed within the period of time that they've been active in Connecticut to allow physical therapists to do that. And there are medical doctors. A former faculty member at the University of Bridgeport, who was an MD, did manipulation all the time.
So you don't really think this is about manipulation or public safety at all? You think that there's an anti-chiropractic bias?
Well, again, they're going to say it is a public safety issue, but they're latched onto this as a chiropractic problem, not as a cervical manipulation problem. And in fact, if they, from a public relations standpoint, I guess one thing is to go attack chiropractic, but if this really was a public health crisis, then the public health crisis does not matter who does the manipulation.
Does this tie in at all with the over-reporting, possibility of over-reporting of the link between chiropractors and injury in the literature?
I guess on the concept of over-reporting, that while there might